Welcome back. In part one, we laid a foundation for understanding trauma, what it is, the different types, and how it can impact people and really our students in unique ways. Now, here we are in part two, and we're shifting our focus. We're going to zoom in on what it looks like in children, especially in the classroom setting.
Yeah, so to gain perspective, we have this statistic here where it says nearly 35 million children in the US have experienced at least one type of trauma. And in the next slide, and one that's even more striking is that 1 in 3 children attending school have been exposed to a traumatic event.
When we think about Frenzy's work of supporting pre K through eighth grade, what we're really talking about is children as young as 5 and as old as 13 or 14. So think about the students in your classroom. And what we know is that trauma looks different across the age range, but the impact is always, always, always significant in the lives of students.
Yeah, so if we look in the slide, we at the young students, it's important to differentiate between the two because it might the manifestations might look differently for younger students than they would for older students. So, for instance, you have rapid mood swings. And this is important because at a younger age, we're still kind of developing that muscle of emotional regulation. So, if you do have something an event that is impactful, that is traumatic, then it actually interferes in children's ability to actually regulate their emotions. So you might see someone who's angry, laughing, shut down. Um, Another thing that we might see is just difficulty focusing or just zoning out. May be mentally preoccupied with the past, so they're talking about the past a lot, or they're talking about the future. What is challenging is that they have a difficult time being in the present because maybe they're just not safe in their body, they're not safe in that environment. Emotional literacy is impaired as well. Students may struggle actually recognizing or naming what they're actually feeling. Might feel someone who's like, I don't really even know what to say. I don't know how to name it. So those could be indicators as well. Physical manifestations. Sometimes we often see this where it's maybe constant movement. You might see fidgeting or inability to sit still. And sometimes you might notice that you may redirect a student, but it just seems like they're just unable to, sit still. It's important to understand that sometimes a child who's experienced trauma their body is really just trying to find safety. And in some ways, fidgeting is the way that they do that. So that would be important to look out for.
So, when we look at trauma in younger students, what we're really trying to do is to help calm their brain so that they can feel safe, they can feel secure, they can engage in the learning process, they can connect well with others. This is true for our older students as well. And so we want to shift the conversation and really consider how does trauma show up for our older students, those 5th through 8th grade students in your classrooms?
And yes, in this case, you might find that the how it shows up may look more sophisticated. So what may happen is that the trauma-related emotional responses become more internalized. So you might see things like withdrawal or isolation. There's a more quietness or avoidance that can be subtle, and a subtle sign of distress, right? Is where they just pull away from people. Focus and attention might be difficult and it might be persistent, where they're trying to focus on something, but what you might find is that during a class, they might be drawing because that's what their brain needs at that time because they're having difficulty to focus. The brain is actually prioritizing safety over learning. right? So if someone is experiencing a difficult or distressing situation, and then we're expecting students to sit and learn in a classroom, their body is really actually unable to do that, right? So you might notice some of these challenges because they're in survival mode. And learning, what we know from research is that learning is very difficult if someone is in survival mode.
And when you talk about survival mode, we're talking about students being fight, flight, or freeze, that those responses where they are triggered and their brain is unable to settle, they're unable to engage the logic part of their brain, and being driven by emotions, reactions, fears, insecurities, doubts. And so when we think about our role as educators and how do we step into this space, because we need to understand, because sometimes it's not a behavioral challenge, it is a trauma response that students are experiencing. And what we know is that schools are often the safest place students go each day. And you, as the educator, can be the safest person in their life. And that's why it's so essential for all of us as part of the Frenzy family to understand the deep and varied ways trauma can impact students. It's not just about giving students character skills, it's about knowing when to call in additional support, because you are not you may be the first line of defense, but you're not the last line of defense. And so do you know when to call in for support so that you can have the support you need to be able to fortify this student?
Yes, and sometimes what we notice is that with older students, that trauma may boil over, right? So you might notice that, there is a specific behavior that is challenging for older students. And like Joy mentioned, you want to make sure that you yourself have support and to reach out to the support that is around you.
And I think it's important when we think about your role as an educator that you don't have to be the counselor. What students need most is a caring adult who sees them and listens to them. And so, as educators, we want to understand what trauma looks like in real time. And the more we can engage with the student with empathy and patience and the right kind of support, we're going to see higher outcomes in that student, not only in their learning, but in their connections at school. And what's important to remember is you don't have to have all the answers, but being trauma informed allows you to ask better questions to create more healing inside the classroom.